Think about it. When you're feeling bad or stressed, or when you're in physical pain, having a loved one touch you, stroke, or rub your back or hands has a calming and comforting effect. That physical touch can help, comfort, and heal. In fact, once upon a time, the hands were a physician's greatest and most important diagnostic and therapeutic tool until modern medicine introduced all sorts of machines and other equipment. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk right here on CNN Philippines. Manual therapy is a special form of physical therapy using our hands. Our guests for today will help us better understand what manual healing is and how it can benefit many of us. Joining us today are Dr. Imelda Edodolon. She's the Medical Director of Holistic Integrative Care Center. And we're also joined by Mr. Michael Gabilo. He's the President of the Philippine Physical Therapy Association. Thank you both for joining us today. Now, manual healing therapy is one method of physical therapy that uses hands instead of a machine or some other device. During manual healing, physical therapists apply pressure on certain parts of the body in the form of kneading and manipulating. Now, Dr. Medi, what does it actually do and what illnesses does it treat?
Manual healing therapy is also called manipulative therapy, which uses a physical therapist's hand to restore mobility and relieve the pain. So it is often used for frozen shoulders, for some forms of arthritis. It's also very good to relieve feelings of fatigue.
Okay, now manual therapy does not only heal pain, but it can also increase your level of fitness. Still with Dr. Medi, please tell us more about this.
Yes, because when we exercise, we use our muscles, we use our joints all exclusively. So what manipulative healing therapy does is it loosens the tightness of our joints. It's very good to increase our mobility. It's actually good to force to move our joints and also our joints.
And if you develop an illness or injury that causes pain or affects your movement, you may benefit from physical therapy. And a physical therapist can help assess your situation and provide focused treatments to help you return to your previous level of function. Mike, what happens during the first session in physical therapy?
Yes, upon receiving a referral from any duly licensed physician, what we do is, of course, first establish the history. We need to establish the mechanism of injury and other comorbidities that might affect the intervention that we are going to provide. And then afterwards, after doing the history, we do a thorough examination because there are conditions that are not really of musculoskeletal origin, but it might be due to, let's say, neurological problems or affecting the other internal organs. So some of the usual activities that we do or assessment that we do is the range of motion assessment. We also check for the neurological, we do also neurological assessment, manual muscle testing, and if there are other special needs or special assessment, depending on the condition, we do that also.
And when preparing for your physical therapy appointment, make sure to write down important facts about the history of your problem in order to help your physical therapist assess your problem better. Still with Mike, ano yung mga tinatanong sa pasyente ng mga physical therapist during yung initial assessment nila?
Yeah. First, important na tinatanong namin is when did the patient experience that manifestation or clinical presentation? Say, kailan ulang sumakit, gaano katagal na sakit, at ano yung activity na ginawa niya prior to that. So those are important notes that we need to consider in designing the program that we're going to implement.
Manual and physical therapies are sometimes used interchangeably and they sometimes cause confusion. Manual therapy is literally hands-on. Therapists use their hands to provide treatment, whereas physical therapy, on the other hand, include not just treatments with their hands, but other equipment as well. Mike, can you please expound more on this?
Yes. Physical therapy is a health profession that deals with basically increasing, number one, the mobility of the person. Number two, when you increase the mobility, you improve the functional ability. And lastly, once you improve a functional capacity of the person, you improve the quality of life. So under physical therapy, one of the specializations or one of the interventions that we give is manual therapy. And yes, manual therapy, from the name itself, it came from the word manus, which means hands. So we do intervention utilizing our hands. But nowadays, there are additional or adjunct equipment that we use in order to better serve our clients.
Manual healing therapy isn't limited to a specific part of the body. There are different techniques depending on what the affected area is. More on this when we come back. Manual healing therapy helps with getting a better range of motion in stiffer joints as well as pain relief. Let's talk about the different techniques used to make this possible. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. Muscle spasms often occur following restricted joints, and mobilizing these joints is necessary to improve the range of motion by performing slow, painless movements. Rest and ice treatment usually doesn't work for this condition because it doesn't get to the root of the problem. Here is where joint mobilization comes in handy. Mike, how is this done?
Yeah. So when you talk about joint mobilization, we do joint mobilization interventions to our patients. If there is, number one, there is what we call pain, particularly involving the joints and the structure surrounding the joints. Okay. And second, we give joint mobilization as an intervention if we based from our assessment, there is what we call limitation of motion. So in joint mobilization, we improve the joint play, or what we call the arthrokinematics. When you talk about arthrokinematics, for us to reach the full range of our movement, there should be a good movement within our joints. So if there are conditions, let's say articular problems like arthritis, and other soft tissue problems surrounding the joints, we can provide joint mobilization. So the patient has to be in a relaxed state. We put the joints in a relaxed position, and we do certain mobilization or manipulation within the joints. And again, this will definitely provide comfort to the patient, and will of course achieve the goal of increasing the range of motion. But there are times that prior to the performance of the joint mobilization techniques, we provide some adjunct treatment to somehow improve the circulation within the area, soften the tense muscle. So that's why we put sometimes hot compress first before actually doing joint mobilization technique.
Now, Dr. Medi, what conditions or injuries ang pakinabang dito sa joint mobilization?
Yes, maganda po ito sa mga pasyente po natin na meron pong osteoarthritis, meron pong some sort of mild forms of rheumatoid arthritis na nakikita po natin sa kanila. There are some early stages po ng frozen shoulders, yung mga capsulitis. Yung mga mild bursitis, pwede rin po ang manipulative healing therapies.
Muscle tension is usually reduced when joint motion improves, but the muscle spasm often remains. Soft tissue mobilization usually addresses this concern. Now, Mike, what other problems does soft tissue mobilization address?
Okay. So when you talk about soft tissues, so we refer that to muscles, to ligaments, to fascia. Okay, so these are just some of the soft tissues in the body that might be involved if there is, let's say, musculoskeletal injuries. Now, soft tissue mobilization can, number one, loosen the adhesion, no? Yung pagkakadikit-dikit ng mga soft tissues that I have mentioned a while ago. So, ang purpose ng soft tissue mobilization is to loosen these adhesions and to increase the functionality of the muscles again. So what physical therapists will do is they sometimes do stretching, okay? And they can do, what we call this the trigger point release. No? In Tagalog, yung ibang naririnig nating lamig, no? Yung may lamig na parang may bilog-bilog dun sa likod natin, or what we call naman in a more technical term, nodules. So these are the things that we address when we perform soft tissue mobilization technique.
Okay, now to Dr. Mehdi, what are some of the different soft tissue mobilization techniques that are effective?
So some of the different things about mobilization techniques that is very effective is number one, the deep tissue massages is really very great. Another one is lymphatic drainages because it's a part of really restoring the joint mobility and relaxes the muscles.
Now, if your back hurts, physical therapy may be an option. It eases pain and helps you move better. Getting physical therapy early may help avoid surgery, and if you do need an operation, it can help with your recovery. The first thing a physical therapist can do is to ease back pain and boost flexibility through manual therapy. Mike, what kind of manual therapy is done for people having back pains?
For persons who are complaining of back pain, and this is if you're going to get the statistics also of persons complaining of pain, particularly due to their work or occupation, napakataas ng statistics nito. So for physical therapy, we give interventions like number one, stretching techniques. Okay, we also provide some. If there are additions, we can perform certain. If the problem rather is the bones of the back, we do spinal mobilization techniques to again improve the joint play of the bones of the spine. And at the same time, if there is a need, certain forms of massage are given to these patients, again to address the spasm and prolonged contractions of the muscles on your back.
But of course, prevention pa rin ang pinakamaganda dito. Dr. Mehdi, what are the things that we can do to avoid back pain?
Okay, the things that we can do to avoid back pains are, number one, we have to maintain our back posture. Okay, one of the things also that we can do for us is buying some orthotic pillows when we sleep, also with some lumbar support whenever we have long sits, and also, syempre, stress management. We have to make our ways to be happy and also lessen the stresses that we have.
Na magandang advice yun. Pero Dr. Mehdi, what is your advice on the best sleeping position for people with back pain?
Okay, for people with back pain, I would suggest we maintain on a supine position. If there is a need for us to put some pillows for back support, please do. Lessen yung patihaya o kaya pa yung pa-side. I-lessen po natin yun. And also check on if we have good mattresses and if we have some mattresses na matagal na po natin ginagamit, maybe it's time for us to change our pillows and also our mattresses.
When it comes to relaxation, we associate it with a few things such as sleeping in until noon, spa days, and of course, getting a massage. Not only does it help you relax, but it also has tons of benefits for our bodies. More on this when we come back. Massage therapy can do much more than help you relax. From easing muscle pain to helping you sleep, it's a powerful tool to help you take charge of your health and well-being. I'm Dr. Freddy Gomez. MedTalk Health Talk is your connection to healthcare. Let's talk about the oldest manual therapy, massage. It is probably one of the oldest healing traditions because of its healing properties and how it treats a variety of ailments. There are several types of massage that focus on different parts of the body. Of course, we all know the Swedish massage. This one's ideal for people who are new to getting a massage or have a lot of tension. It can help release muscle knots, and it's a good choice when you want to just relax and feel good. Dr. Medi, what are other types, common types of massages, and what are they specifically for?
Okay, aside from Swedish massage, the other types of massages are number one, hot stone massage, wherein we put hot stones on the back. Another one is aromatherapy massage, wherein we put some essential oils that will greatly improve our relaxation techniques. Another one is deep tissue massage, wherein the physical therapist will perform deeper type of massages within the tissues. Another one is sports massage. One of my favorite is trigger point massages, wherein the most painful area of our tissues are being pressed. Another one is reflexology massage, and of course, the shiatsu massage.
Now, Mike, how about massages that are good for injuries and relieving pain?
Because there is a notion that when you talk about this, when you deal with physical therapists, some are claiming that they are physical therapists, but when in fact they are just only doing massage. No? So there's a difference between a massage therapist and a physical therapist. So for massage being one of the treatments or one of the interventions that we give, we provide, for example, for burn patients, we offer forms of massage to basically prevent scarring. Okay, and also, for example, for patients with, let's say, who had back injuries or muscle spasm, we do cross-fiber massage. For example, for some form of overuse or repetitive injuries, we provide massage as part of that treatment. So it's not just only massage, but it is actually a portion of the interventions that we provide.
One of the immediate benefits of a massage is a feeling of deep relaxation and calm. Mike, what else does it do for our bodies?
These therapeutic massages, aside from what we have said, relaxation, it also improves oxygenation to our soft tissue. So improves circulation, vascularization to these areas. And at the same time, massage will somehow soften or loosen, again, the adhesions to the soft tissues.
And before we go, Dr. Medi, meron ka bang mga advice para sa ating mga viewers?
Manual healing methods is very important. Also, we have to emphasize on some stress management techniques that we have to do it daily. One is affirmations for us to relax. Another one is frequent nature trips. Very good nutrition. Also, our diet is very important for us to relieve inflammatory mechanisms of our body. And most precisely, if you need anything, if you have some back pains, also some neck pains, please do a massage. And if symptoms persist, please consult your doctor.
And Mike, do you have any message for our viewers when it comes to therapy or physical therapy?
So for our viewers, if there are, of course, problems in your body, particularly if there is, let's say, back pain, there are specialists that you can consult, and together with your doctors, your physical therapist will be there to provide you with the correct and proper interventions. And being an exercise prescriptionist and movement experts, we can provide you with these suggestions. And again, it is better to have early interventions before we experience the worst of the scenario.
We'd like to thank our guests for today, Dr. Imelda Edodolon, Medical Director, Holistic Integrative Care Center, and Mike Gabilo, President of the Philippine Physical Therapy Association. We appreciate your time very much. Manual therapy is a tool to minimize pain, and sometimes, like magic, physical therapists do wonders, letting us get back to moving normally and helping improve the quality of our lives. While some people opt for surgery because it's a faster and more effective method, others would rather not go under the knife. So what works best for you? The choice is yours. This is Dr. Freddy Gomez, helping build a healthier future for you. Thank you for watching.